I do have a couple disclosures that what I'm talking about I had worked on since I was a fellow, so over 10 years ago. Since then, a company called Cortex has commercialized it to OnQ prostate, but I'm going to be speaking about it more in my research. I have an R01 on the topic, and we're doing some really interesting work with this. So I think we're going to answer some of the questions actually that at least provide some opportunities. I always had the same thing that we're all struggling with the same stuff with MRI sequencing, so I think this might provide, and Dr. Turpe already showed this slide with PIRADS 3. This is the positive predictive values, right? They're all over the map. So how do we address this MRI quality issue? So when I look at apparent diffusion coefficient, other than our radiology colleagues that were up here doing an amazing job, what Ralph Klayman would say, this is a snowstorm over Iowa. Basically, it's really difficult. There's different globs here. I don't know what's what. When I'm in the clinic trying to show a patient something, it's very difficult to say, oh yeah, that's it. Some of us that read them a lot can do it, but a lot of the, just pulling this up in front of a patient, you have to have a lot of confidence to do that. And these ADC maps can be, we talked a lot about that earlier, there can be a lot of distortion. And there can be blood clots or inflammation that can impact these things. So the title of it, right, restricted water. So there's kind of three components of water that impact the MRI. So there's that free water that just freely can go wherever it wants. There's this interstitial water where if you have more cells, then it blocks it and it kind of reduces your ability, and you can see that ADC drops down because you're blocking more of that free water. And then lastly is the restricted water. So this is the water within cells or within nuclei, and it just